We have a gentleman who was for 15 years had a very severe autoimmune disease, which made him barely able to walk and in pain every day. And after 6 visits, he's walking. He's on a treadmill. He's walking the dog for the first time ever, and he's been out of pain. What a change of life. It's about changing the quality of life.
We are talking about the individual and their family being diagnosed with a condition, whatever that condition is. And now they struggle to find good solutions. And sometimes just around the corner, there's something that we can grab, just like I'm grabbing this water. And maybe, we're not promising it, but maybe if you try something, you will have major progress in what you're trying to accomplish. Today, we're going to talk about red light therapy and light therapy in general. You will be learning about a full body red light therapy treatment system and red light therapy bed. You'll be learning about frequency medicine and frequency healing and different wavelengths and frequencies and how is that affecting the body. And it's all very important in the context of integrative healthcare, because we all know that there's a lot of people who go from doctor to doctor, provider to provider. You know them, I know them. Sometimes they follow recommendations, they still don't feel better. And we want to support. We want to share more information, share the research, share resources. So maybe on that journey, we can make the recovery much, much faster. And you may be watching also as a provider, and sometimes all that is missing is just that extra tool in your toolbox. And that may be it. The information may be super exciting. You may be very hopeful after watching this. And at the same time, because it's so powerful and what you will hear, there's just some magical, miracle-like testimonials that I'm seeing for this technology. I also want to have a disclaimer here that we are not treating any disease with this video. We are not promising any specific result that will prevent a disease or anything like that. But you will see the information and the research is so fascinating and so powerful that I will just leave it up to you what you do with the information yourself. You will hear it from the founder himself and the inventor himself. I am here with the founder of Trifecta Light Technologies, a full-body red light therapy treatment systems, and he is the inventor of Trifecta Red Light Therapy Bed, Dr. Carl Rothschild. Welcome to Polish Your Life.
Thank you very much. Really appreciate you having me here.
Thank you for being here. I really appreciate your time and your energy and your attention for this interview. So I'm thinking a lot of people forget information, but they remember stories. If you could share a story that is about red light therapy that you want people to remember.
I've been doing light therapy from the beginning. We were part of a pioneer group that started with light therapy 25 years ago, something like that. And the technology has just grown unbelievably. But even back then, with a device that was thousands of times weaker than what we have today, even back then, we were having very nice results. But now with stuff that's that much more powerful, and the fact that we're bathing the body head to toe with this light therapy, we're starting to hear things, and we have been hearing things that are unbelievable. So an example is, and this is more recent, and I have dozens of these. Fred called up, and he goes, Doc, when the provider called up first, he tells me that Fred has severe congestive heart failure and has an implanted defibrillator. The guy's in bad shape.
Wow.
And I just told the guy, I said, just put him on the bed for 5 minutes and monitor him the whole time. We know that the bed is unbelievably safe, but you don't want to have someone have a catastrophic event having nothing to do with what you're doing with them if they're in that bad shape. So just monitor them the whole 5 minutes, just 5 minutes. That night, just after that 5-minute session, that guy had an unbelievable experience and so much better. And he calls me up the next day. Well, the provider calls me up with that guy on the line. So all three of us are talking. And Fred tells me that for the first time in years, he had an erection. Now, that might not sound like a big deal to some people, but that was huge. And he was feeling so much better. And he's so far away that he was worried that he wouldn't be able to come in that often to treat. So to make a long story short, he's going to get his own bed. I told him 3 times a week for at least a month to start off with. And again, we're not talking about curing, we're talking about treating. And I could only report to the kind of results that we're getting with the bed. Now, before the bed, that we had other equipment that was pads that we would put on various parts of the body, primarily for fat loss. We never got this kind of feedback with the pads. And I love the pads. It's great for aesthetic and fat loss and skin and all that stuff, but we never heard the kind of thing. The first person that got to me was this lady calling us up and telling us about her mother who had dementia and Parkinson's. I know I'm going from one story to the next, but
No, please do.
Almost every other day I'm getting this kind of feedback, but at any rate, the first time we knew that we were onto something is we created the bed because of COVID. We wanted to have a bed because of the less physical contact with the provider and the patient. And we went along with creating this bed, sending it out, thinking it would just be basically a replacement for the pads. But with the pads, we never got this kind of feedback. And she's telling us about her mother, who they couldn't handle her mother anymore. She was 85 years old with severe dementia and severe Parkinson's. And she was belligerent and difficult and didn't remember anybody. And they couldn't handle her at home anymore. And it made them, of course, very frustrated and sad. They got the bed specifically for their treatment of the patients in general, but maybe more so for the mother. And even after the first visit, they noticed a difference with the mother. And by the end of the first month, that mother's quality of life changed so dramatically. And she became so lucid and so much more flexible that that was the first time. That was the first person that clued us in that something's going on here. And then the feedback started coming on a regular basis. So we have this lady that had a stroke, and within 2 weeks, there was no more sign of a stroke. And I told you about the congestive heart failure. I could just go on and on with every kind of condition you can think of. We have a gentleman who was for 15 years had a very severe autoimmune disease, which made him not be able to walk or barely able to walk and in pain every day. He didn't have one day in over a decade that he didn't have pain. And after 6 visits, he's walking. He's on a treadmill. He's walking the dog for the first time ever. People now seeing him in the neighborhood, and he's been out of pain for that period of time. Now he's going to need treatment for a long time and conceivably on maintenance for the rest of his life. But what a change of life. It's about changing the quality of life. And I just tell you, as a chiropractor, I've been a chiropractor for well over 4 decades. And our motto was always, maybe we'll think of something before surgery and drugs. We're not against surgery and drugs, but how about if we try the alternative first? And if that doesn't work, then we understand that there's a great need. If someone's in a car accident and their arm gets severed off, don't rush them over to their chiropractor. Get them over to the emergency room. I get that. There's a great opportunity here to be integrated with all kinds of different services, but we'd like to try the alternative, if I want to use that term, the natural healing first. And I am telling you that if you try the bed first, before you do any of these things, 90-something% of the time, we're seeing great results with that.
This is remarkable.
You would be hard pressed to find a condition. I'd like your people to call in someday in the future. Just what condition could it not help? Because we haven't found that yet.
Wow. Well, a lot of people, when they hear stories like this, naturally, and from their experience, they're going to be extremely skeptical. And I have seen a lot of these testimonials that you mentioned because they are also on Trifecta YouTube. And as I'm watching them, sometimes you see that people are in front of a camera. They are, they're about to say something and it doesn't look real. But these people, some of them laugh, some of them smile, some of them are just, very modest in what they say, but what they say is just unbelievable. And as I'm watching this, that's why I decided to show what your bed can do to our doctors in the group. We have this mission to promote integrative healthcare, and I'm very careful not to also be deceiving because I don't want to give false hopes. with the interview, with the technology. We've been on the provider side, we've been hit by so many different companies, so many different people, that this is the next big thing. And naturally, people are going to be extremely skeptical. So if that's you watching and you are like, yeah, right, I completely get it. I just wanted to let you know, let's look at the science behind these things. Let's look at the information. Let's connect with Dr. Carl if you may have any questions, because who knows? There's always this next big thing that comes in, and the first response is sometimes going to be skepticism.
Mike, hold on. Listen, where do you think I was at 25 years ago when Chadwick Smith, who's a relatively famous medical doctor out of USC, and he comes to me, and I'd known him before lights. He comes to me and says, I'm bringing this technology to the United States. We're going to shine a light on somebody's body, and it's going to make a difference. And by that time, I had been in practice for 20 years at that point. And of course, I know it all. And that's ridiculous. That sounds silly. Talk about skepticism. There is a history now of 25 years of history of light therapy. But back then, there was no history of it. I mean, very little. And so I just said, okay, because I knew this guy and I trusted him. I said, okay, we'll try it in our practice. And I tried it with my associate doctor. And I remember one time we met in the hallway and we said, yeah, I think this thing's working, and it was just we had just had a laser that had a head that, like an ultrasound head. So you're putting it on different parts of the body. So it's not like we're doing, and my patients would come in, this is great now. My shoulders feels fantastic. My TMJ, whatever. We were working on every muscle, joint, tendon, ligaments. I had a person that had ripped Achilles tendon, and we started seeing the results, never hearing anything about the kind of things I'm telling you about. Because once we're able to bathe the entire body at the same time, that's what's made the difference. I'm telling you, I've done all kinds of work with lasers and pads and all that. We never got this kind of feedback that we're getting now. And nobody was more skeptical than I am. I mean, I became a chiropractor. So just becoming a chiropractor, you have to have a little less skepticism, because that's already a leap of faith about this, whatever we're doing in the natural healing. But a light, shining it on somebody sounded crazy. You know what it's about? It's about the sun. That's it. So if somebody tells you they came up with the latest and greatest, what's more latest and greatest than the sun? And all we're doing is we're taking elements of the sun, only the best. There are 4 wavelengths that we use in the near infrared and red range that have been proven to be unbelievable.
How is that? You talk about chiropractic. I wanted to ask you. So we have the light therapy and all the technological revolution equipment types here, and then we also have chiropractic here with innate intelligence that you talk about, and also, like you mentioned, a little bit of faith in the fact that it's going to work. And then we have the faith and the science and the experience and the years and years of proving that it actually works, and it does work. So for chiropractors watching, because I have quite a few chiropractors in the group here, so now we will have them thinking, okay, how does light therapy and chiropractic integrate? Talk about just a little bit about why did you become a chiropractor? Because I think a lot of them can relate to this. And also, what about that jump, from being a treating chiropractic physician, and you had multiple clinics, not one, and now to basically being the pioneer of light therapy? Let's talk about that a little bit.
First of all, why I became a chiropractor. So this dates back to early 70s. My girlfriend at the time, her mother was saved by a chiropractor, which in New York, which is why it was actually a step below a voodoo master. I mean, it was junk. I laughed at it and I just figured this is crap. But as I did more research and I interviewed that chiropractor, I became intrigued. And I come from a family that if you're not an attorney or a doctor, they kind of mourn for you at the end. When I told people I was becoming a chiropractor, they thought I lost my mind. Absolutely. And that kind of fed into it because I was very rebellious back then. And I was kind of a hippie of sorts. We're talking about 1969 when I graduated high school to graduating college. By the time I went from 69, a very straight, short hair. By 73, when I graduated college, I had long hair. I considered myself a hippie of sorts, and I love the idea of alternative stuff. That I wasn't going to be introducing poisons into the body. I wasn't going to yank essential tissues out of the body. And when I started chiropractic school in '75, wow, what an awakening! It was amazing. It just changed everything. And I do a lecture about the germ theory and the environmental theory, and it has to do with whether is it the body or is it the germ that's most critical on why we get sick. And how red light therapy helps with immune system and all that. But it's very simple, everybody. Just go to Google Scholar and put in the word photobiomodulation, which is what this is all about. Photobiomodulation. Just put that word in there and you'll get over 21,000 hits of articles, research papers. This is not junk. This is not regular Google where people can pay and do, they're trying to sell you something. These are research papers from universities and press, all over the world. And there are thousands of them. There would be much more if the kind of money that was behind pharmaceutical industry was also behind red light therapy, but it isn't. But 21,000 hits, you'll be able to research all of that. And then as a filter, you can put any condition in there, any condition, including cancer, including the aesthetic world, the fitness world, the weight loss world. There are so many people that are affected by red light. And I have somebody that right now, talk about stories, that has absolutely severe Lyme disease, like horrific. And she goes, every time I go out in the sun, I feel better. As if we hadn't talked yet. I said, that's what it's about. Imagine magnifying that many times, filtering out the stuff that we don't want from the sun, magnifying it many times and driving it into the body. That's what this is all about. There is no latest and greatest. It's the sun. There's no latest and greatest. When I hear it's, we're not, and by the way, you asked about chiropractic and how it integrates. We're not saying bed only. We're not saying don't do other things. We're not saying that the person shouldn't exercise, take care of themselves. If a person has a bullet wound in their shoulder, let's get the bullet out, and then we can talk about healing it. And if a person has a bone out of alignment or has issues with chiropractic-oriented or orthopedic-oriented or whatever, you can also do those things as well. The bed is a great foundation. So we start off with the bed, and then we do all these other things. We also incorporate, with the coils, with the PEMF, with all kinds of different frequencies. Our bed has right frequencies embedded in it, but also we have external sound frequencies, vibrational frequencies, and the PEMF. So we're going to give the body no chance of not working. I mean, I'm sure someone's going to find something that the bed can't help, but we haven't found that yet.
Wow.
Thinking about hundreds and hundreds of cases.
Dr. Carl, so looking at the movement towards incorporating red light therapy and light therapy in general, frequency healing, and so many different devices, because you had them and you do have them right now on the market. Some of them more popular, some of them less, some of them more powerful, some of them less. What is the inspiration in this whole story that we are hearing? And thank you for helping us paint the picture of who the founder is, because that's also, I want people to understand that the product is a byproduct of who we are, because there's not only technology but also the passion behind creating this product. So I think people can paint a picture to that point. So tell me about the moment that you actually decide to invent something that is different. While you have so many technologies on the market, why would you invite something on your own?
Look, you see my arm? It was twisted behind my back, and people were telling me, we need a bed. I didn't want to make a bed. And the reason why I didn't want to make a bed is because the other few that were out there at the time were very expensive and they didn't work so great because the technology wasn't there yet. But because of COVID, I was forced into making a bed. And COVID said, we want less physical contact. Okay. As I said with the bed, you go, Judy, get in the bed. Judy gets in the bed. She gets out of the bed herself. And that's it.
For those of you who don't know, Dr. Carl has a mug on his desk that says, get in the bed. That is awesome. Do you have that mug here?
I don't know if you can see it.
Oh, yeah, we can see it now. Yeah, awesome, awesome.
I didn't make this. One of our people made this for me because this is my attitude. It's like, I have this problem, I have that problem, I have this issue. Would you just get in the bed, try it 6 times, and you might be the first one that doesn't see dramatic changes in 6 visits. But let me also tell you that even mental stuff, I mean, we have therapists, psychotherapists that are sending their patients to our beds, and we're hearing basically 100% change, that it helps even with mental and emotional issues. In fact, the 9 divisions of our company include mental health, senior citizens, the performance and recovery, which has to do with athletes. So our athletes get in the bed before their activity, before they're, like we have that boxer, before the boxer gets in his bout, has his fight, he's preparing months in advance, or at least a month in advance. And the bed is an integral part of his getting ready. And then afterwards, every boxer is going to come beaten up. So whether he wins or loses, he's got all kinds of bruises, whatever. He gets in the bed and he will recover from that so much faster. So all these different categories of face and skin and healing and fat loss, even fat loss. And that was what really prompted me, maybe more than anything, 12 years ago, to say, you're telling me that there's an element, that's what they had just discovered around them, that there's an element of red light that actually helps a good diet. It will help that person who's plateaued out. It'll take them to the other side and help them with that fat loss. And anyhow, so I'm not going to, I wish I could, I'd like to tell you that it was all because I'm brilliant. It was because I was forced into it. Mm-hmm. And then within a month, that lady called us up. This doctor calls up and says her mother had that advanced Parkinson's and dementia. And then we realized, oh my God, this is so much more than fat loss and so much more than minor stuff. This is taking us to a whole nother level. And then we just kept developing it, making it better. We have a new system that came out where the lights burn still very strong, but they're even cooler. And that's always been the limiting factor, is how hot the lights get. So if your light's getting hot, heat is you want to avoid heat. Heat is the enemy. Heat will attract more fluid to the surface, and that'll block the penetration of the lights. You don't want that. So you don't want heat, and that's why our first devices that we developed were called cold lasers. Not because they're literally cold, they just didn't heat up. You didn't want heat. Well, you want warmth, but not heat. And that's what we've been able to develop. It's always, the limiting factor has always been heat. And the success of anyone is to get lights that will be even stronger, but most importantly, not get hot.
Got it. So for the people who are very technical and maybe they already have a lot of different devices that they either evaluated or maybe they have them in their practices, right? So maybe there's an acupuncturist or a chiropractor or another type of provider watching this right now and thinks, okay, give me the specifics. I want to know, okay, what's exactly in this bed? What technologies do you use there? Let's talk about the types of lights that you have and the different technical aspects that typically providers ask you about. And then when you give them the answer, they say, okay, I didn't know you have that. I'm really interested in these specifics. Not that I will understand it. I want to understand a lot of it, but I think some providers are really saying, okay, you say it works, but how is it different than what I have? How is it different than what I tried?
Listen, if somebody has a bed that bathes a person from head to toe, front and back, inside and out, gets the depth of penetration and the kind of results that we're getting, then God bless them. But if they don't, if they're not getting that, here's what it's about. What they discovered, and remember, my first device 25 years ago, that was all about near infrared, not red, not infrared. And by the way, when people talk about infrared, you know what they're talking about is far infrared. Far infrared is just a wonderful way of creating heat. It doesn't change the structure of the cell. And so here's what near infrared does. And they didn't know this right away, but what they've learned is that near infrared affects the mitochondria. In fact, you're going to hear the term mitochondria way more than ever before, because we're seeing that term come out with the vaccination, with many other things with mitochondria. And it comes down to mitochondrial activity and mitochondrial dysfunction. So how does this work? So the light has been shown to stimulate the mitochondria to do what it was supposed to do. It's not about overstimulating anything. It's about getting the body back, getting the body parts and the body in general back to normal. So I'm telling you, I do a presentation on erectile dysfunction, and we talk about how it will increase testosterone. And again, if they go to Google Scholar, they can just put in the word photobiomodulation, the word testosterone, and all the research is there. So I don't have to have them see any particular research that I'm going to provide to them. They can see it on Google. So I'm telling you that I'm talking to these people about increasing testosterone, and a question comes up of, well, could it be too much testosterone? No, it's about bringing the body back to normal. It's not about excessive amount of anything. No, we're not putting anything in the body that shouldn't be there, and we're not yanking anything out of the body that should be there. It's about bringing the body back to normal. So getting back to the mitochondria. Now, by stimulating mitochondria by this near-infrared energy, and a little bit red light, but the near-infrared is way more powerful. In my opinion, and from all the research that I've done, it's near-infrared. Near-infrared, by the way, is a range of light that, there's this whole rainbow that starts with violet and goes on the other side to red. Past violet is ultraviolet. Past red is called infrared or near infrared, far infrared, mid infrared. Mid and far infrared don't do the kind of things we're talking about. It's the near infrared that does this miraculous stuff. The range that we're really finding great results with is the mid 800 to the mid 900 nanometers. And that's where we get our near infrared. The red is in the 600 nanometer range, from probably around 600 to 700. And the mid 600 is perfect for us. And we have two reds and two near infrared, two types of reds and two types of near infrared that have been shown to be just beautiful. And it was the red that they discovered 12 years ago, give or take, that actually by accident realized that the red could actually change the permeability of the fat cell wall and allow the fat contents to leak out. It's a totally different mechanism. It's not about mitochondria there. Getting back to the mitochondria, if you look up mitochondrial dysfunction, you'll see that there are practitioners and there are professors and there are research guys that are determining now that maybe mitochondrial dysfunction is the cause of many problems out there. And maybe that's why we're seeing unbelievable results. Again, I was forced into it to create the bed. So I don't want to take credit for people forcing me into it. So maybe, you talk about COVID, was there good news and bad news from COVID? If it wasn't for COVID, we would have not developed the bed, most likely. Forced into it, and then within a month, starting to get the feedback was like our mouths dropped open, and we go, oh my God. And then over the years, what we've wanted to do is to create even a better bed. So our bed is much more customizable. Our first bed, you get in it, you get out of it. There's no, the person who's 100 pounds is getting the same dose that a person who's 400 pounds. Now with our latest bed, you're able to customize the bed completely with power and frequency. And frequency, people say, what do you need frequency for? Well, first of all, by pulsing the wave, we're going to be able to dissipate the heat even more. So we can have even more power with less heat. That's number one. But maybe even more importantly is the frequencies. As people learn and study about frequencies, Rife frequencies, Nogier's frequencies, solfeggio's frequencies, these different frequencies synchronize and sympathize with different tissues in the body. So it actually creates this resonance with different tissues. And there are different frequencies that each of our you can choose whatever frequency you want. But I have my favorites, and I instruct people. Remember, when a person gets our bed, they get all kinds of instructions, both basic training, advanced training, and coaching, and all kinds of stuff, because I want people to have no reason not to be unbelievably successful. Our goal is 20 people a day, 100 people a week, and that doesn't take much. We have most of our people get that within 3 to 4 months, and then the good news is that then they need another bed from us.
The actual application of the technology, even though it is so complicated, you have some programs that people can press on a specific program, right? And the program is going to do the work, or the provider has to have, a PhD from all these frequencies to know how to customize it.
It's very easy, and we instruct them on it. I have certain wavelengths that like 60% of the people are going to get the same exact dose because they're average size and they have the same kind of need. But if somebody comes in with some unusual problem, we can tweak it. And hey, watch my finger. I'm going to change the frequency. Boom, 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 boom. Changed. I'm going to change the power. Boom, 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 boom. Changed. it takes a second or two. So if we want more power going into someone who's bigger, or, I have one guy that he doesn't look all that big, but he turns it up to 70%. And I'm a little bit smaller than him, but I guess I'm dainty, and 50% is perfect for me, and it takes a second to change those numbers. Listen, I've had 15 practices. I've had many associate doctors, and to train a chiropractor could, at a school, an intern with me, it could take a year to get them up to speed and learning the therapies and the treatment and the managing and all that stuff. And to train somebody on the bed there's just 5 settings, the 2 settings for the red and the near infrared on the frequency, the 2 settings on the near infrared and red for power, and the time. That's it. And if it takes a half an hour for me to train somebody on how to do this, it shouldn't take a half an hour, but I'll give it a half an hour, not a year, a half hour.
What about contraindications? So what type of people, conditions who should not get in the bed from your experience?
That's a tough question. The reason it's a tough question is there are 2 reasons in life in this kind of question. One of them's got to do with the fact, if I can say this, there are too many attorneys in this country, and they are looking for business, and they'll sue you for any reason under the sun. So if it rains that night after the person gets in the bed, it's your fault. So we don't treat pregnant women, not because in other countries they're treating them, because it's wonderful for the mother and the fetus. But if that kid comes out wearing a mustache, they're going to look all around the neighborhood to see who they can blame for that. You don't want to be in that neighborhood. The other thing is active cancer. In other countries, they're treating people with active cancer and they're having great results. In this country, cancer is like a garden. It likes to grow little things. And if a tumor pops up over here, they're going to be looking all over the neighborhood to see who they can blame for that. So maybe you don't want to treat that. But by the same token, we got, I don't know if I could tell you this, and you can edit this out if you don't want it on there, but just got a call from a lady, one of our practitioners, and she said, this guy has advanced prostate cancer. And now his studies are coming back normal. Really? Okay. So I don't know if I'm allowed to say that. What am I saying? I'm just saying, we're just seeing, it's just anecdotal. The reason why the research is tough to come by is because most hospitals are not, they're the ones that are getting these more difficult cases. As a chiropractor, I didn't get a lot of people coming in with Parkinson's and all these severe kind of things. It's the medical doctors that are seeing them. And we've got, as you know, we recently interviewed Dr. Bennett out there in Newport Beach, medical doctor, and he's in love with this stuff. And I've told him, I said, look, get us more difficult cases, more of the cancers and stuff, because as a medical doctor, they can treat that. As a chiropractor, I can't start advertising that I can save your kidneys. I can, but I can't advertise that. So, but we've seen great results with every organ, gland in the body, the brain, I told you already about. When the person gets in the bed, we have them just keep their eyes closed instead of wearing goggles, because we're seeing phenomenal results in the eye. We're talking about macular degeneration. We're hearing about that. We're hearing about great results with floaters, cataracts, all kinds of things like that.
What about anti-aging and skin? Because you talk about it a lot in other content, in other videos, and I haven't asked you, and we haven't talked about it yet. Can you give people a good scientific reason why it actually works for skin, for anti-aging, for wrinkles? What's the mechanism?
I'm saying mechanism. So every tissue in your body is made up of tissues. Every tissue in your body is made up of cells. Every cell in your body has this thing called mitochondria. And not only one, when I went to school 1,000 years ago, we were taught it was one nucleus and one mitochondria in every cell. Well, guess what? They know now that there are up to over 5,000 mitochondria in every cell of the heart, for example, because of the demand. So every tissue in your body, and especially the skin, is made up of cells. Every cell has a mitochondria. We're getting the mitochondria to be better, remember about bringing the body back to normal. So the skin results are phenomenal. So example is any skin condition. We've seen results with eczema, psoriasis, with acne, even cystic acne, just about anything. But even shingles, which is really not a skin condition. And as a chiropractor, I really didn't have an answer for shingles, and now I do.
Wow.
And we have a lady, who is it? Somebody was calling us up about having a condition that was affecting their eye. It wasn't an eye problem, but the skin condition they were having was actually affecting their eyes. And I haven't gotten the feedback on you, but you know what I tell everybody, just get in the bed. And I know that down the road, we're going to see changes. What I do, I tell my practitioners, look at 6 visits to start, then 3 times a week until we reach that target, whatever the target is. And then getting the person on a maintenance program. There's the 3 phases, and that's what I teach everybody.
Sounds very simple. And that's what I like about this, that it's relatively, while the technology is very complex, because you're combining multiple different types of technologies and settings and different technologies to even allow the main technology to penetrate deeper, right? Like the ways to dissipate heat, the ways to pulse the light, the frequency, healing and integration with chi coils and other therapies that we were talking about. It's all very, very fascinating. And I think that people watching may have some questions, both on the patient side / individual side and on the provider side. So is there anything that you would like to mention that you haven't mentioned yet to someone watching, if they have any questions to you, maybe a frequently asked question that you wanted to answer before we go? I just wanted to make sure we give you an opportunity to say that.
I get a lot of skepticism from people in general. And I apologize right from the beginning, because I know I come across like, and I'm sorry. But when I get calls, not every day, but almost at least every other day, about, well, you didn't tell me about this, and how about that? But I'm the kind of guy that you come to me and you say, it's completely safe. It couldn't hurt anybody, no matter what. The worst that ever happens is nothing. And the upside is incredible. When I started in chiropractic, if I went to a chiropractic convention that many years ago, there was not any mention about red light therapy. Now, if I go to a convention now to chiropractic and many other therapies, many other types of practitioners, you'll see, and especially in a chiropractic convention, you'll see a lot of information about red light therapy in the exhibiting booths. There'll be several booths dedicated to red light, because it's getting popular and it makes so much sense to the chiropractor. See, the medical doctor that brought this to the United States, he assumed his medical doctors would back him with this thing. And so now imagine I go to a medical doctor and I said, I want to show you how you can make less money, because you won't have to do those surgeries, because you won't have to do, this and that. I don't want to get involved with the pharmaceutical industry right now. He didn't get one of his orthopedic surgeons to follow him, because they didn't want to make less money.
And that's what's really bothering me in this whole system, because we are talking about the individual and their family being diagnosed with a condition, whatever that condition is, and now they struggle to find good solutions. And sometimes just around the corner there's something that we can grab, just like I'm grabbing this water, and maybe we're not promising it, but maybe if you try something, you will have major progress in what you're trying to accomplish. And some of these solutions are hidden, and I don't appreciate that. I think that the providers in our group really appreciate that we are promoting integrative medicine, where we just work together. There's no one provider, one technology, one type of treatment that will solve all problems, even though it may seem like it is possible. Sometimes you need to combine different things. The power of integration, communication, and just being open with all these resources. So then whether the individual wants to grab it or a provider wants to grab it, they just take their hands and eyes and ears on it. They absorb the knowledge. If they want, they try it. And that's what I appreciate about our group and you being part of our community, is that you are sharing your perspective and your experience, your passion about what you have built and how is it working. It's not that you built it yesterday and now you see something happen. One success story, let's tell the world. We've talked quite a few times before this interview, and I know that this is being rooted in so many different testimonials, and all these things are also rooted in the science behind all these technologies, and you were able to combine them together in a product that becomes a service that you're proud of. And that passion I appreciate, and I know a lot of people appreciate. And I really thank you for being here, sharing this information. And if you're watching this on the provider side or individual side, comment below. You may have questions. You may want to connect directly with Dr. Carl, ask specific questions, ask generic questions. I think it's all about getting the information to the right people at the right time as well, because as somebody is going through different hoops to get to better health, sometimes they may get the information when it's a little bit too late. And I think it's important to keep that in mind. So when you talk to Dr. Carl, please mention this interview. Please mention Polish Mike, myself, or the Polisher Life Doctors Networking Group, because we may be able to get you some VIP preferred provider treatment if it's possible. I will talk to Dr. Carl about details about it, but the most important is just if there is something that sounds promising, check it out before you discount it as something that is another, gimmicky thing, because it may be the real deal. That's what people did about the internet. Oh, it's going to be another fad. It's not going to work. I'm never going to put my credit card information. Guess what? We are meeting on the internet. You're on the West Coast. I'm on the East Coast. I think that internet thing has been working pretty well, right?
Possibly.
So just
I wanted to point
stuff.
out, when we were talking about the internet, you see this, is my finger pointing to the website?
That's right.
If they go to the website and scroll across to the page that says testimonials and watch the first bunch of patient testimonials, because those are on the beds, and watch the first bunch, 4 or 5, that are on the practitioner videos, those are all on beds. And then you get a taste. Listen, it doesn't serve anyone's purpose in the new age of deceiving anyone, and I'll tell you why. Once the person realizes they've been deceived, it's all over the internet, and you can destroy a company with that. This is not about that. There's no downside for trying it. And there's a tremendous upside of trying this technology. My suggestion is try the technology and maybe even get the best. That's my suggestion.
Very cool. I appreciate you, Dr. Carl. You are amazing. The passion is just, flowing from the screen to the viewer or listener. I really, really appreciate you. I wish you a wonderful day. Keep rocking, keep doing these things, keep developing, because you will be hearing about new science, and just integrate it in the new version or the newest version of your product. Keep developing more. Don't stop, and just know that there is a bunch of people, including myself, that really appreciate that. All the best, and thank you for watching.